The people who live in Edmonds are really focused on community.
I love this community. I love what it stands for. I love its history. I love its natural beauty. It is truly a unique place.
It's a community that prides itself in education. It's a community that prides itself in the arts.
I understand why people come and want to be a part of this community.
The great thing about working at Swedish Edmonds is it's really the quintessential community hospital. And we live here. I live in Edmonds with my family. My mom lives here. The physicians on the medical staff, we all live in this area.
I live right downtown, and it's a wonderful community.
It's important for me personally, as you know, a son and as a father and as a husband, that my family has access to world-class facilities. And I want a place that sees everybody.
On any given day, I'll see newborns, I'll see teenagers, I'll see elderly patients, and then we have our international community, which is huge.
Because of that diversity, we see a lot of different things.
One of the wonderful things about Swedish Edmonds is that we're part of a greater system. We can take care of so many things here, but if we need that backup, we have it.
One of the exciting changes I've seen in our community over the last couple of decades is the growth. But with growth comes change. We need to keep thinking ahead.
We are looking forward to the next 50 years and how we are going to meet the growing needs of this community.
Swedish Edmonds is an integral part of that. They want to look at the future. We want to look at the future. We need to understand how we can grow together.
This community needs more resources than what it's currently getting, and Swedish is meeting that need with this new expansion.
This campus is literally going to be transformed. It's going to transform our facilities, it's going to transform the way we provide care, it is going to allow us to provide the right care in the right setting at the most affordable cost.
This expansion is about providing a modern, world-class facility to the community. It's about providing the broad range of acute care services, from urgent care to emergency care to an observation unit, as well as providing a diagnostic imaging center.
The new ambulatory care center is really going to give our patients a choice that they didn't have before.
We have a really unique model with this new building, and that is that we have an urgent care literally right next door to an emergency department. And that's not something you see in many places. And I think it reflects Swedish's vision of providing innovative care.
Right now, when patients are coming into the emergency department, it's not uncommon for patients that are coming in with a minor injury or sniffle or cold to say, I'm so sorry to take up your emergency room bed. I know there's sicker people, but I have nowhere else to go.
We'll be able to provide affordable care to patients in our urgent care, as well as the patients who truly do need critical emergency care. We're going to have that for them as well.
And the wonderful thing about Swedish Edmonds is that it is a community hospital, and it's been here for 50 years, and it's not uncommon for a patient to come in and say, I was born in this hospital, and my kids were born in this hospital. And it's wonderful that we're going to be able to serve the community better for the next 50 years.
Edmonds is really a community of families, and I love that. It has a small town feel. You walk down the street and everybody knows your name, you know their names, and there's a tremendous sense of community. I think it's absolutely critical to have high quality care as close to where you live as possible. It really brings it home when you're faced with an emergency situation, which is a situation that happened with my mom. She was admitted to the ER. I was out of town and was faced with an emergency situation with her, and it was very, very scary and very difficult. I couldn't imagine my life without my mom. When I walked into ICU, I saw my mom there for the first time, really so vulnerable, and I felt helpless. What made it more comfortable was the fact that the hospital is very close to where we live, and I knew that she would be receiving excellent care. It was a huge comfort with the support that the hospital provided. They were outstanding in helping me, educating me, and providing the support that I needed in order to make those really life-critical decisions on behalf of my mom. Swedish Edmonds saved my mother's life, and I'm truly grateful for that, and she is too.
Edmonds is truly a family place with all the great parks. There are so many little families walking around every day, moms with strollers. It's just a really warm and happy place to be for a family. My husband and I were expecting our first child. and we delivered at Swedish First Hill in Seattle, which is where we lived then. I had a healthy pregnancy, everything was normal. However, after a long labor, our healthy 9-pound, 2-ounce daughter was born and was fine, but then an hour after birth, I looked down and I noticed that Helen had stopped breathing. My husband ran out of our room to find our labor nurse, and she immediately called the code because she saw the just horror in Nick's face. They got her breathing, and they immediately took her up to the NICU. In a moment where I was so utterly shocked and powerless, I felt so in awe of these people who knew exactly what to do to address the scariest problem I'd ever seen in my life. We got released from the NICU much sooner than we expected, and to hear that she was most likely going to be an absolutely normal child, it was the best moment of my life. My family is beyond grateful, and I mean my extended family, for the care that the Swedish system offered us through one of the hardest times in our life. As an active young kid myself who made several trips to the emergency room and urgent care centers, I know with an intrepid explorer such as Helen, I foresee several urgent care visits in our future. And it just is so reassuring as a mother to have something just down the road to get quality care. And Nick and I and Helen are really looking forward to having Swedish Edmonds as our new home hospital.
It's really important that we know we have a hospital that we can depend on with high quality care in our backyard. And that means the world to me.